many people rapidly joining tonight's conversation. So good afternoon to everybody in the West, and good evening to all of those of you that are in Eastern time zones. Thank you for joining us for a conversation on the toxic drug supply and overdose crisis in our country. It's my privilege to be speaking and joining you today from the territory of the Nuu-chah-nulth people on Vancouver Island. We're joined today by members of Parliament and Deputy Mental Health and Addictions critic Lisa Marie Barron from Nanaimo, our health critic, MP Don Davies from Vancouver Kingsway, Leslie McBain representing Mom Stop the Harm, and BC's former public health officer, Dr. Perry Kendall. Each of us will make introductory comments, after which we'll open the virtual floor to questions and comments from you. And just want to make a note that participants can click on the closed captioning button on the bottom of your screen. Please also note that the Zoom chat is closed until the Q&A portion opens after the speakers are done in approximately 30 to 40 minutes. And we'll announce when it's open and you can begin to submit your comments and questions at that time. We've limited time for this event, so only questions related to the topic of the town hall will be recognized. So please ensure that all comments are respectful as well. As the NDP critic for mental health and addictions, I didn't hesitate when I drew a high number in the parliamentary process for establishing the order for MPs to be able to table and debate private members' bills. I knew from my colleagues in Parliament, from my constituents, and from family members, from friends and neighbors who've lost loved ones to the toxic drug supply and overdose crisis. That is how I needed to use this opportunity to generate a debate in the House of Commons on a health-based approach to substance use. I tabled Bill C-216 on December 15th, and the debate began on March 5th, the first hour of debate. We all know the situation is dire. More than 25,000 Canadians have died of overdoses due to a toxic drug supply in the last 6 years. And in the shadow of COVID-19, the overdose epidemic has rapidly worsened across Canada. The Public Health Emergency of Canada projects that 3,000 more people will die this year alone, in the first 6 months of this year from this cause. And decades of criminalization, a toxic illicit street supply, and a lack of timely access to harm reduction, treatment, and recovery services has caused this escalating epidemic. It's time to treat substance use and addiction as the health issues they truly are, and to address the stigma and trauma. This bill provides a comprehensive approach to do just that by decriminalizing personal drug possession, providing for record expungement, ensuring low barrier access to a safer supply, and expanding access to harm reduction, treatment, and recovery services. This bill will save lives. Much of the work that's already been done has been done on this bill was by our health critic Don Davies, who actually tabled this bill in the last Parliament. It was cut short by what in turn was an unnecessary election. So we'll hear from Don in a few minutes about what's included in the bill. He'll break that down. But first, I want to take the time right now to turn the floor over to NDP leader Jagmeet Singh, who's been speaking out on this issue for many years. Jagmeet, I want to thank you. I know you're not able to stay until the end of the town hall, but we'll be sure to pass on questions and comments that are directed to you for after. And I want to thank you so much for your leadership on this critical file. Jagmeet.
Thanks so much, Gord. I really appreciate your kind words, but I also got to say I thank you for your leadership. When I appointed you the critic for addictions and mental health, I knew this was the right thing to do. And you are someone who cares deeply about this. You've seen the pain that the toxic drug supply and overdoses have caused in our community. You've experienced it up close and personal. And I know this is something that you're going to continue to champion in the way only Gord Johns can. Thank you for doing that. I also want to thank our deputy critic for mental health and addiction. Lisa Marie Barron is doing a great job as a new MP, and I'm really proud to have you on the team. And thank you for joining Gord on this. And I also got to thank Don for the work that he did to get us to this point with this bill, and the work that he does as my health critic. I'm just really thankful. And thank you to everyone that's joined. Thank you for being here. It means so much that you're all here. I also want to thank Dr. Kendall and Leslie from Mom Stop the Harm.
I think you're okay to go again, Jagmeet.
Thanks. Yeah, I just I pressed the button and then I muted myself there by accident. Thank you for that. And so I just want to share that what we've seen for so long is that the current approach to people living with addiction, mental health, people dealing with poverty, people that end up using, for whatever the reasons are, people that end up using, the current approach is to criminalize, is to stigmatize, is to arrest, to bring before the justice system, and to potentially incarcerate. None of this helps. It doesn't help the person that's struggling with that addiction, the person that might be struggling with mental health concerns, the person that might be struggling with poverty, or whatever other causes that lead someone to using. That is not going to be addressed in any way. They're not going to be any better off with a criminal justice approach. Our communities are not safer with a criminal justice approach. This approach costs lots of money, but it's not saving lives. So what we're calling for is a fundamental shift to acknowledge if what we've been doing before is not working, why should we continue down that path? Why wouldn't we listen to the evidence? And we're going to hear lots of evidence, but why wouldn't we listen to the evidence that says we need to take a compassionate approach, a healthcare approach? If we want to save lives, there is a better way, and that's what this bill is about, taking that better path to save lives. And I can just share with you one personal example in my life. My dad went through a really tough period of time for a long period of time, over a decade, of struggling with an addiction. And it's something that I saw firsthand, the pain of that addiction. He did things that he did not want to do. It's clear this is an illness, but he could not stop the cycle. And it would not have made a difference if he went down the criminal justice path. The only way that he got better is to get rehabilitation services. And in my dad's case, he had lost his practice, he lost his livelihood, he had to declare bankruptcy, we lost our home. And the only way he was able to get help was a publicly funded rehab center that happened to have a bed available. And he was able to, at that point in time when he decided he needed help, doctors told him that if he didn't do something about his addiction, he would die. He decided he wanted to live. And in that very moment, a bed was available just by chance, and he was able to get the help he needed. There are so many people that make a decision to get help, but there's no help available. There's so many people that want help, and in that moment, don't have the help. There's so many people that want help, but are afraid to reach out because they're worried about the stigma. There's so many people that don't want to talk about what they're dealing with because of that stigma. And we know that people are losing their lives needlessly because of the stigma. So this bill is about changing the course. It's about acknowledging that we need to care for people with compassion and healthcare. That's the way out of this. And that's why I'm so honored to share my voice to champion Gord, our MP. He's putting this forward as his bill, and all New Democrats are supporting this. This is our motion. This is our fight because we are here for you. We're here for families. We're here to fight this crisis because we want to end it. We know that this does not have to continue. So many people have lost their lives already. No more lives should be lost. And that's why we're really committed to this approach that let's follow the science, let's save lives. And I'm really honored to be here to add my voice. And I want to thank you all for your presence. And thank you again, Gord, for your leadership. And thank my team for all the hard work. This is going to be something really important. And I'm proud that we're the ones that are leading the charge in terms of a healthcare and compassion approach. Thank you so much.
Well, thank you, Jagmeet. It means so much to your compassion and your commitment to getting behind this bill. And next, I'd like to invite Leslie McBain from Mom Stop the Harm to speak. This organization has been invaluable in the construction of this bill and the feedback, and this bill reflects that, a lot of their asks, and in creating momentum really across the country for action. Mom Stop the Harm is a network of Canadian families impacted by substance use related harms and deaths. They advocate for changes in failed drug policies while providing peer support to grieving families and assisting loved ones who use or have used substances. Leslie, I want to thank you. And I want to thank you for the love and courage, and to every single family member in the Mom Stop the Harm network. Leslie McBain.
Thank you, Gord. Thank you, Jagmeet. You said everything that I was going to say, but I'll say it again. It bears repeating. My son died of a drug overdose in 2014. So I know that drug use is real. I know that addiction or substance use disorder is real. And some people who have substance use disorder or addiction have individual stories that will break your heart. Racism, poverty, mental health problems, trauma of all kinds, PTSD, physical and emotional pain, all these aspects of the human condition might lead to drug use. So it is not a moral issue. It is a public health concern. As such, those who die are dying because various levels of governments have failed to keep people safe from the black market-driven toxic drug supply. Current and past drug policies on all levels are what are killing people. Prohibition, if you like. It didn't work for alcohol in the 19 teens and 20s, and it is still not working, and it does not work for drugs as well. If there is a failure of policy, of courage, and of will to treat and protect our loved ones who use drugs, is there? Yes, there is. At Mom Stop the Harm, we would like everyone to be able to access appropriate care, a continuum of care, which is something we have been asking for years, for more than 6 years, including a safe supply, low barrier access to a full range of treatment and recovery options. Nobody wakes up in the morning and says, boy, I really like being addicted to these dangerous substances. Nobody. But until the care is offered is comprehensive and accessible and appropriate to the individual, people are stuck with the illicit, toxic, and often fatal supply. And here's the kicker. People who access the drugs that they need, the only way they can be arrested, go to jail, have a criminal record, have their drugs confiscated by the police. That is criminalizing a person who is just getting the medicine they need the only way they can. So decriminalization. In order for decriminalization efforts to be effective, the adopted policy must be, at a minimum, protect the majority of people who are at the highest risk of drug-related harms. And any model must also reflect the realities of how and how much people use and how they purchase their drugs, if it is to be successful. And success means reducing overdose risk, limiting police encounters, and promoting connection to the full range of healthcare, from harm reduction to treatment to recovery. On the topic of decriminalization, not to get into the weeds on it, but setting threshold limits too low, and that is how much a person is able to carry before they become fodder for the police to arrest. If the thresholds are too low, it will likely result in the majority of those at highest risk of overdose remaining vulnerable to arrest, being charged with possession, or having their drugs confiscated, a result that will only exacerbate risk and harm. Decriminalization is not simple, but it is not impossible. And if we go with this bill, if we run with it, if we support it, that's going a large step to destigmatizing this country. Addiction is the only disorder wherein people are made to go to drug dealers in sketchy circumstances to get the medicine they need. Why is this? Stigma and lack of political will. And again, C216, thank you, Gord, and Dawn addresses this terrible irony. We need to explore new ways to separate people from the toxic drug supply. That means expanding access to prescribed safer supply, but also looking at non-prescriber based models that take a public health approach to legally regulating substances like we do for alcohol and for cannabis. Our children are dying even as we speak. As a humane and empathetic society, can we not include all people in the safety net of care? Safe supply, homes, a living wage, equitable health care, policies that save lives instead of killing people, the people we love. Everyone in this audience, please support our politicians like Gord Johns and Jagmeet Singh, Lisa Marie Barron, and across party lines, politicians like Elizabeth May, who get it, who know that 20 deaths a day in Canada is not only tragic and life-altering for the 26,000 families left behind, but it is morally abhorrent and it is preventable. We can do better. We must do better. And if I didn't have hope, I would not be sitting here talking to you tonight. Thank you so much.
Thank you so much, Leslie, and again to all the members of Mom Stop the Harm and for your courage and strength. It's now my pleasure to bring the NDP critic for health to the floor, Don Davies, who was first elected to Parliament in 2008 and has worked diligently on drug policy reform. He represents the riding of Vancouver Kingsway, which has lost hundreds of constituents to the toxic drug and overdose crisis. His work on this bill has been seminal. I invite Don now to brief you on its content. Thank you again, Don.
Thank you, Gord. First of all, I'd like to acknowledge that I speak to you from the traditional territories of the Coast Salish people, the Musqueam, Squamish, and Tsleil-Waututh nations, by whose grace we live, work, and play. I also want to start with some thanks. I want to thank my colleague, Gord Johns. For anybody who is aware of the system, when your name is drawn at the beginning of a parliament, and you are able to bring forward and introduce legislation on anything at all in the broad gamut of politics in Canada, Gord chose this bill. And I think it speaks to Gord's sense of compassion and courage that he highlighted this very real crisis facing us. I also want to thank Jagmeet Singh, our leader. I remember back in 2017 when Jagmeet was running to be leader of the federal party. And that was the first time I ever heard any leader of any political party in this country ever talk about decriminalizing drugs. He was the first. And that took an incredible amount of courage and insight, compassion, and frankly, vision. I also want to thank Lisa Marie Barron, who as a first-term MP is just doing tremendous work in not only representing the people of her riding, but in supporting Gord in this bill. And of course, I'd like to thank the other participants, Ms. McBain and Dr. Kendall, who have been giants in terms of advancing this issue in civil society. I have a couple of preliminary remarks. One of them is I'd like to say that this is one area where I think the public is far ahead of politicians in this country. For a long time, I think politicians have been scared, cowards really, to talk about the issue of hard drug use, that's drug use beyond cannabis or alcohol, for fear that they would look like they're soft on drugs or that they were saying something bad. And I think, to be honest, what this did is this reflected and frankly deepened the stigma. But the reason the public is so far ahead is because I don't think there's a single family in this country, not one, that is untouched by addiction or alcoholism. My own family, my father died of a methadone overdose when I was 20 years old. I have reams of relatives who have suffered from alcoholism and addiction in various ways. And I don't think my family is unique. Everybody has an uncle or aunt or father or mother, brother, sister, cousin, child themselves who has struggled with substance use, dependency, or addiction. And the bottom line is I don't think we regard any of those people as inherently criminal. We view these people as our loved ones who are struggling. And so I think the time is overdue for us to have our law reflect that. I was trained as a lawyer, and one of the phrases I remember learning early on, in fact, before I even went to law school, was this phrase that the law is an ass. This is, I think, a prime example where the law is indeed an ass, because what the current law does not only does not work in the way that it's intended, but it actually causes the very harm that it proclaims to address. So I just want to address some facts, because I think every politician likes to say they believe in facts. They like to believe in evidence and science-based approaches. And let me also say, while I'm on that subject, that we have at least two pandemics in this country. One of course, COVID-19. The other is the toxic drug pandemic that has gripped this nation for a long time. And the numbers of people who have died in this country are actually comparable from overdose from toxic drugs on the street as from COVID. And in fact, I think it's important to note that despite the rhetoric of the Trudeau government and other politicians who claim that they believe that drugs should be treated as health policy, the facts are that the number of people who have died from drug overdoses have risen every single year since the Liberals were elected in 2015. But that's not to pick on them in a partisan way. It's to illustrate in a very profound way that what they're doing is not working. In my view, incrementalism kills in this area. The result of incrementalism in this policy area actually creates fatalities. And that's not true of many issues, but it's true of this one. Here are some facts I wanted to just rattle off. First of all, the history of criminalization of drugs is this. It's based on economic interests. It's tainted by political considerations. It's heavily influenced by racism, and it's virtually totally devoid of evidence or a genuine concern for policy aimed at reducing drug use or problematic or otherwise. What drugs are or are not legal is not based in any way on science or evidence, but rather it has always been based on considerations of power and interests. So the entire structure of our criminalized approach to drugs was never based on or intended to reflect any kind of science or policy goals that could or ever would result in reducing drug use. Second fact, the war on drugs, the policy of criminalization, has not worked. I think it's fair to say that we have collectively spent billions of dollars. We have harmed millions of people. And now we have decades of empirical data. This is not a subjective opinion. This is cold, hard numbers to prove that it's an utter, total failure. You know, there's a saying in recovery that the definition of insanity is to do the same thing over and over and over again and expect a different result. Well, if that's the case, then the war on drugs is not only a waste, but it's truly a phenomenon of insanity. The conclusion there is, quite obviously, after decades, we can't arrest our way out of drug use and addiction. We can't punish, shame, or interdict our way out of either. Another fact, substance use is a disease. It's actually listed in the DSM-5 as a recognized psychological mental health issue. I personally am a big fan of Dr. Gabor Mate, whose theory is that the basis for addiction is almost invariably trauma, which again, I think points to the absurdity of our criminalized approach to drugs. When I gave a speech in the House of Commons on this, I pointed out that society has no greater sanction than the criminal law. The whole point of it is to traumatize, from the point of your first contact with police to the indignity of arrest, to being thrown in, a holding cell, to have to, go into the intimidation of a courtroom with all the trappings of power, to go through a trial, to be sentenced and then thrown in jail, is all intended to traumatize the person. That's the base of it. So how ridiculous is it for us to take someone whose fundamental issue is that they're a victim and sufferer of trauma, and think that by re-traumatizing them, we can help them? It's simply ridiculous. On the same point, I also want to point out that not every drug user, of course, has a dependency or has substance use disorder. There are many, many Canadians who are users of drugs who don't have any issue at all, and criminalizing them makes as little sense as well. So the fact remains is that substance use disorder is a health and, I think, a social justice issue. It's not a moral, character, or criminal one. So this is the framework in which we approached this issue back in 2018, when, as health critic, I decided to draft a bill that would comprehensively change the way that the federal government and federal law deals with drug use, and the key there is the word comprehensive, because again, I don't think we can tinker with this. We have to comprehensively understand what is the criminal taint on the way we deal with drugs, and let's reverse that. So we drafted a bill to modernize policy based on evidence, based on safety, and based on compassion. And that resulted in what is now Bill C-216. Gord has touched on the 6 elements. I'll just go over them really quickly before I end. One of them is that to take a comprehensive approach, this is we have to decriminalize all drugs, all drugs. The arguments for decriminalization and against criminalization apply with equal force. Doesn't matter what the substance is. Number 2, we must take the supply of drugs out of the hands of the criminal world, who have no interest whatsoever in the health or safety of any drug user. And we have to create a regulated, low barrier, safe supply for all drugs. I'll talk about that in a moment. Third, we have to do everything we can to destigmatize. And now stigma is a very large problem that can't be addressed by the federal government. But to the extent that we can do it, what we thought we would do is we should expunge all criminal records associated with this, because criminal records, they stay with people forever. They affect employment, they affect housing, they affect travel, etc. And then the 3 other components are, we want to have strong prevention and education programs, because nobody advocates drug use as a healthy exercise. We have no judgment on it, but nobody is actually saying it's a good thing or encouraging it. So we need to give young people and all adults access to health-based information to educate them about the risks and dangers of all drugs, because not all drugs are the same. Some are potentially more fatal than others. And finally, universal access to treatment on demand. And this is where I want to end. I want to focus on 2 things: the safe supply. It must be regulated. Now, what this bill does is it would decriminalize immediately, it would expunge records immediately, but it would create a process by which the federal government has 1 year to work with a wide variety of stakeholders, all stakeholders, including people with lived experience, addictions experts, physicians, police, community leaders, families that have been affected, everyone, to determine what a regulated low barrier safe supply would look like. And I don't think anybody has any firm or final answer on that. I think components of that could include pharmacies, not with prescriptions, but over-the-counter access, because anytime a drug user can intersect with a healthcare professional, that provides a touch. It provides an opportunity for that person to butt up against the healthcare system. I think that's a good thing. And of course, pharmacies are already places of dangerous drugs. We have the systems in place where they have secure systems, control of known titration, and the ability to make sure people get the drugs that they know they're getting in the right concentrations. Maybe it's mobile dispensaries, and it's the sky's the limit. And finally, treatment on demand. We're proud of our healthcare system, but it is not comprehensive. And one of the ways I think that our 2-tiered access to care is most obvious is in treatment. If you got $20,000 a month, you can get treatment in a day. If you don't, you probably won't get access to treatment, even if you want it and need it. The nature of addiction is obvious. We know that people have very brief periods of time when they're willing to get treatment. That is the nature of the illness. And so that's why we have to create the architecture where if someone is willing to get treatment, we can get them in right away. And to get them in to the right kind of treatment, because there's no one size fits all. So we have to create the healthcare architecture with multiple modalities, 12-step abstinent-based tapering systems, treatment options for women, Indigenous people, youth, opioid, alcohol, etc., because there's a wide range of modalities that are needed. And that should all be paid for through our public healthcare system. And all of those things are what this bill does. And I think that if we're going to truly put some force behind the assertion that we want to treat drug use as a health issue, then these are minimal, the first steps that we need to do that. No longer can we just listen to nice words where politicians claim that they want to treat it as a health issue, but they won't touch the federal legislation, which is the Controlled Drugs and Substances Act, which criminalizes all of it. You can't on the one hand, say you believe in treating as a health issue, and then refuse to touch that bill, which continues to criminalize the purchase, sale, and use of drug use all over this country. So I'm really proud to be part of a party that has the courage to pursue this. And with your help and the help of the millions of Canadians who I know are affected by this this disease every day, I know that we'll get there eventually. Thank you.
Thank you, Don. Really appreciate you breaking down that comprehensive, approach that we've been working on and you've been working on. It's now my pleasure to introduce my next colleague, the Deputy Critic for Mental Health and Addictions, MP Lisa Marie Barron from the Vancouver Island of riding of Nanaimo, who I just joined on my national tour on this bill, where we met with many frontline service providers and also people living drug users themselves. With more than 25 years of experience working alongside and advocating for some of those vulnerable people in her community, she really understands what it's like to work on the front line, to create change, not just talk about it. So it's a privilege to turn it over to Lisa Marie Barron. Thank you, Lisa Marie.
Thank you, Gord. It's just to clarify, so Nanaimo Ladysmith, we can't forget Ladysmith in my writing as well, of course. But I so appreciate being here today. Before I get started, I just wanted to acknowledge that I'm located on the traditional territories of the Snuneymuxw, Snuneymuxw, Staminas, and Layaxon First Nations, in which I am so grateful to live, work, and raise my two beautiful young humans on this territory. I wanted to give a huge shout out to my colleague MP Don Davies for the development of this bill and all of his work before I came into this position, and for passing the torch on to my colleague MP Gord Johns, and for Gord's passion and dedication to this work. I'm so thankful to be working alongside these two. Also, thank you to Jagmeet Singh, our leader of the NDP, who is here today. His ongoing leadership and fighting for people is ongoing. It's so great to see. Of course, thank you to Leslie McBain from Mom Stop the Harm for sharing your story and for your ongoing advocacy and work. And to Dr. Kendall, who hasn't come on quite yet, but I'm so looking forward to hearing from Dr. Kendall and hearing more. But he's so much work to keep people healthy and safe. And we're just so fortunate to have both Leslie and Dr. Kendall here with us today. And of course, I purposely have everybody on a gallery view because I love seeing everybody's faces and seeing the responses. And I will say it is so heartwarming to see your faces, but also to see the amount of head nodding and thumbs up that's happening while we're speaking. It's so nice to see you all, and for taking time out of your busy schedules to be part of this really important discussion. And I look forward to the questions coming. I wanted to just add on a few points. There's been a lot of really important points that have already been discussed, and I don't want to repeat because I want to make sure we have time for those valuable discussions. But I did want to reiterate, as MP John's board had said, I worked frontline in addictions. That was my role, one of my roles prior to getting elected as member of parliament. And I bring with me that experience and those relationships that I built while I was in that role. And I think about when we're talking about this bill today, one man that I worked with, his name was, I'll call him Ben for the purposes of us discussing today. Ben had reached out to me seeking supports around his substance use. He was eager to access treatment. He had recently lost a close friend. Unfortunately, his friend and him had used poisonous substances. He had survived, but his friend was not so lucky. And he had reached out to access supports. He was a soon-to-be dad. He was eager to access support so that he could be there for his son. He bragged to me about wanting to go back to school to become a carpenter, and was really excited about the safe home that he was going to build for his soon-to-be child. Unfortunately, at the time that Ben had reached out, there were no treatment options, period, available within this area that we are in. And Ben needed access. He described to me, he needed access to detox from the substances that he was at that time reliant on in so many ways, and also to begin the work of getting supports around the trauma that he had experienced throughout his life. While Ben waited for access to treatment, unfortunately, it took too long. He started using substances again. His hope for a better future dwindled, and then I never saw him again. And I think about Ben quite frequently. I wonder if he accessed the support that he was seeking. I wonder if he's okay now. And I think about the fact that there are so many like Ben who are reaching out, wanting to access supports. His story is not one, unfortunately, that is in isolation. Too many are wanting to access supports and are not able to get it. And so, I think for me, the part of this bill, on top of all the components we've already talked about, but the importance of having a national strategy is a big piece of this bill for me. We see that there are many good examples of programs and organizations that are doing it right, programs that are informed by those who are using substances, programs and services that are offering on-demand detox and treatment, that provides low barrier harm reduction supports, including access to safer supply. There's so many programs that we're seeing with education and prevention programming, which of course we know helps with the destigmatization of those who are using substances and increases the likelihood that people will feel safe in asking for help and support. But these programs are unfortunately often pilot projects or without secured funding that has a plan for the future, and often offered in silos. We need to have a national strategy that provides the federal leadership necessary to begin saving lives. Too many people, even just one person dying from a poisonous drug supply is too many. This is an emergency and we need to address it as such. We need a comprehensive, and as Jagmeet said earlier, and I heard others say it as well, and compassionate public health approach. We saw what we were able to do through COVID. We need to be treating this in the same way. We know it is possible. It is an emergency, and we need to be treating it with the urgency that it requires. I don't want to take away from future speakers and from questions, so I will pass it back to Gord, but I wanted to say a big thank you and hi sepka to everybody for being here, and I look forward to continuing the discussion.
So appreciate your comments, Lisa Marie, and your work around this, and I think you really touched on it. Like, we showed what we can do in our response to COVID, and we've lost almost as many lives to this poison drug supply. And I think you said to me once, people who use drugs, it shouldn't be a death sentence. So it's a real honor and privilege to introduce Dr. Perry Kendall, who's with us today. And Dr. Kendall served as our, here in British Columbia, our public health officer for 20 years. And he's considered to be one of our country's leading authorities on public health and drug addiction. He was co-chair of the task force on the feasibility of supervised injection site research and was instrumental in developing needle exchange programs and Canada's first safe injection site in Vancouver in 2003. Dr. Kendall, it's a huge pleasure to have you here, and I'll turn it over to you. So much to hear from you, and we're excited to have you here on this panel.
Thank you very much, and I greatly appreciate the opportunity to speak to this topic. I would first just like to acknowledge that I live and work on the unceded traditional territories of the Lekwungen speaking peoples, the Esquimalt, Songhees, and Wasanich peoples. I have 5 minutes, so I'll try and be brief to cover off. I would say initially that I agree with basically everything that has been said by the previous speakers, and I thank you and your party for putting forward Bill 216. When I did declare the first provincial health emergency on the toxic drug crisis in 2016, and while we are comparing deaths from the toxic drug crisis to the deaths from COVID, I would like to point out that, at least in BC and probably across the country, the age at which people die from drug poisoning is considerably lower than those who die from COVID. And if you look at the potential years of life lost, it is many times that that has been lost to COVID. Any death is tragic, but we're particularly seeing 78% of deaths in BC in males between the ages of 20 and 60. And that's a huge waste of life that is preventable. When I look and analyze the toxic drug poisoning crisis that we have to acknowledge a couple of things. One is that humans, and indeed non-human primates, and indeed mammals and non-mammals, all have a long history of being interested in intoxication. And the human interest in being intoxicated goes back to sort of pre-written historic times, and the earliest evidence of brewing alcohol formulation is probably from 14,000 BC, and it actually precedes formal agricultural practices. And there is a theory called beer before bread, which you might want to look at. But human and community interactions with intoxicating substances, psychoactive substances, goes back many, many, many millennia. But somehow, as has been pointed out, in North America and Western Europe, our societal approach to that is totally it's just not scientific, it's not rational, it has no bearing on the pharmacokinetics or human behaviors, the inherent dangers of any substances being regulated, or the economic incentives that controlled drug programs put in place. And the drug policy, as has been mentioned, it criminalizes individuals for a socio-medical condition. It is punitive and discriminatory, it's intolerant and marginalizes people. And certainly BC has the unfortunate distinction, I think, of being the cradle of the anti-opioid laws from 1907, with race riots against Oriental people in Vancouver, followed by the Opium Act in 2008. The impact of prohibition, among other things, has created what might be called the Iron Law of Prohibition. This was a theory, a postulate put forward by an economist, Richard Cohen, in 1986, who said that the natural economic and logistic pressure from the attempts to criminalize and prevent the interdiction and punish people who bring in illegal drugs has a natural tendency that it favors ever more compact, hence ever more potent, hence ever more toxic materials. So we go from opium to morphine to heroin to fentanyl to carfentanil. It's an inevitable progression. If you're bringing in substances for which there is an increasing demand, it'll be met by the black market. And in order to avoid interdiction and increase the rewards, those substances will become increasingly potent and increasingly toxic. So there is, as has been mentioned, an inherent contradiction in our Controlled Drugs and Substances Act, even if one believes that that act was put in the first place to try and keep harmful substances away from individuals and communities, which is manifestly incorrect when you look at what we legalize and what we regulate and what we heavily promote, as opposed to what we control and attempt to prohibit. We can see that, as has been mentioned by Don, it's had exactly the opposite result. We have produced a very toxic drug supply, which is very profitable, which is unstoppable given the technologies that we have with the internet, with the pharmacology that's available, with the ongoing ability to synthesize ever more potent synthetic opioids. So we have now reached a place where I think that we have to do more than just generate good ideas about treatment and pilot projects. Historically, we have some indication, or south of the border anyway, some sense that overprescription of opioids led to the state that we're currently in terms of toxic drug deaths. I would challenge that, actually, because although Canada has, since the 90s, had the highest per capita consumption, well, second highest global per capita consumption of codeine and other opioids, that wasn't actually associated with really large, significant increases in drug overdoses deaths. We did see some increase in the death rate in HIV in Vancouver in the mid-90s, but that was related more to the admissions of cocaine and heroin than it was to heroin. But historically, in BC, looking back at it, although our illicit drug deaths were unacceptable at 200, the amount of prescription opioids that were involved in that was relatively low, 60 or 70 a year. What we did see was perhaps that over prescription created dependency or an ability to use these drugs and enjoy these drugs or become dependent on them. But the continent-wide reduction in opioid prescribing removed from the market, removed from people who needed it because they were dependent on pain, removed from the access of people who had become dependent on opioids, a safer pharmaceutical supply, and that was replaced over time with heroin. We saw the deaths start to increase from heroin. And then because fentanyl is much easier to bring in, you don't, as an importer, have to deal with warlords, with cartels, or with mafia. You can get on the dark web, and back in those days, you would get in touch with a pharmaceutical company in mainland China, and you could receive supplies of the drugs over the mail of such potency that even a 30-gram package could contain potentially thousands of toxic overdoses. So this leaves us today with a situation that is complicated by COVID, where we have across Canada and North America really unacceptable and pandemic levels of preventable poisoning deaths. What could we do about it? Well, I think Bill 216 lays out a really good framework. It talks about the ultimate effort being a discussion and a reform of our current drug laws. And Don gave some opportunities, some thoughts about how that might happen. I would add to that to say that there is an organization in the UK called Transform, which has given a lot of thought to this and has put out some excellent guidelines if you wanted to look at them as to how different classes of drugs could be regulated, whether they be stimulants or depressants. But in the interim, we clearly need a safer supply. And as Don has pointed out, a lot of people who are dying from opioid overdoses or from fentanyl poisoning would not actually meet the criteria for opioid substance use disorder. So to think that we can treat our way out of this with prescription drugs and access to treatment is not going to be the case. 40 to 50% of the cases reviewed in Vancouver were from individuals who did not have a dependency. They were using on a weekly basis, a weekend basis, maybe every couple of weeks or so. So to stop those people dying, we need that public health distribution model, perhaps some variety of the Compassion Club model that's been put out there. So provincially and territorially, this is a challenge. And I think we currently, what little safe supply we have is basically funded and supported by the federal government. And that needs to be expanded and needs to be encouraged. We also need to move toward a regulated drug supply. But in the interim, as Don said, I think the decriminalization of personal possession for personal use is an imperative. We do have a model that could be looked at. It's been running for nearly 20 years in Portugal. It has its flaws, but it has had no tragedies associated with it. But it's critical that the amounts that are allowed for personal possession and personal use have to be significant enough that we won't see a net widening and we won't see people falling through the cracks. It needs to be enough so that it will actually meet reality and the reality of today's streets, where the supply is very toxic, but people have achieved really significant tolerances to levels that would kill you or I. We also need to build in the harm reduction and evidence-informed prevention and treatment. Much treatment today, if people are rapidly detoxed and then sent back out into the world, it actually has been shown that they are at higher risk of overdose because they've lost their tolerance. And we need a regulated oversight. We need evidence-based treatment that is accessible to all, starting from primary care and moving onwards. We need to expunge the possession charges, as you have proposed, and we need to really address the vulnerabilities that make some people much more susceptible to substance use, to misuse, and to dependency. And we can do that addressing socioeconomic vulnerabilities, addressing mental health vulnerabilities, and addressing the trauma that is all too common in the people who are victims. So those are just my few thoughts from my analyses of the issues that are going on, and I certainly give the bill and its proponents all my support. Thank you.
Thank you so much, Dr. Kendall. Thank you, all of you, MP Barron, MP Davies, Leslie McBain, Jagmeet, for your comments. We're going to open up the chat now. Just while we're doing that, I just want to read, just in my home province, illicit drug toxicity is now the leading cause of unnatural death in my province, accounting for more deaths than homicides, suicides, motor vehicle accidents, drownings, and fire-related deaths combined. That's according to our chief coroner. It's a tragedy that's happening right now. And, you know, I just lost a friend that I grew up from high school just 9 days ago that, you know, was a professional, and she used recreationally, and that's a preventable death that happened. So it's impacting all of us. I'm still looking in the chat, so please put your comments or questions in the chat, and we're going to just have to do really fast through this, and we'll keep your comments as well and look at them. Okay. Yeah, so maybe as we're looking at it, okay, here's a question. Oh, geez, it's moving really fast. So, okay, I am going to go with, I'm going to have to start just at the beginning. I think David Arbor, he says, thank you for all your work on this bill, as drug addiction is a part of the overall mental health crisis. Do you think that this bill can be a building block toward the overdue creation of a universal mental health care system in Canada? I really appreciate it. Don, I think, do you want to jump in on that? Because you've spoken a lot on this issue.
Don, you're muted.
Can you unmute, Don?
Yes, I keep unmuting and then they unmute and I mute again. Anyway, thank you for the question. By the way, thank you to all of the people who've joined us today as well. I really, it's wonderful to see so many people interested in this issue. I thank you. That's a very perceptive observation, I think. And it gets to the heart of the matter, which is to start viewing substance use disorder as a mental health issue. Again, it's not a moral failing. It's not a character deficiency. It's, you're not being a criminal. It's really people who become dependent with that complex biopsychosocial disorder of substance use. It's really no different than any other garden variety mental health issue, whether it's bipolar disorder or depression or anxiety or anything else. And so I think it's really important that we start viewing it that way. And it leads to the larger question of, is, as I pointed out, in terms of our system not being comprehensive, we don't cover dental care, we don't cover pharmacare, we don't cover mental health care, we don't cover auditory care, eye care. These are all gaping holes in our public healthcare system that is still left to, you know, those lucky enough to have private coverage through their extended benefits if you work and have those benefits. And I believe it's time. In the NDP, we've been really championing the expansion of the covered public basket of insured services in our public healthcare system to include those things, and mental health care is one of them. And so when I talk about making sure that anybody who has a substance use disorder should be able to access appropriate care on demand through our public healthcare system, that should be the case for anybody suffering from any kind of mental health disease. And so, you know, we have talked about that publicly, and we'll continue to champion that.
Excellent. Susan Davies writes, given the recent Justice Committee embarrassment during review of the laws criminalizing sex work in Canada and the misinformation bias in the committee's work, how will you ensure only legitimate, ethical, empirical data and information is considered, and that facts, evidence, and voices of those people most impacted drug users form the foundation of the law if your bill is accepted and makes it into committee for study? So I think a couple things, you know, I'd probably go back to Dawn on this because it would go to Health Committee. But before I do that, I just want to state that the bill really does reflect what Health Canada's own expert task force recommendations were made. And the Liberal government promised that they would let the task force recommendations guide them on policy. So we're delivering basically a bill that reflects that. So, you know, I mean, we can have more and more testimony, but we've heard from the government's own task force, yet the Prime Minister didn't include it in his speech from the throne. It's not in the mandate letter for the Minister of Health, and it's buried in the Minister of Mental Health and Addictions, like it's sixth, you know, on the list of action items. So it's already deep in there. And maybe Dawn, do you want to just touch on how we can make sure that getting it to committee, that we can ensure that we're getting testimony from experts and evidence-based decision makers?
Well, again, thank you for that. I mean, and thanks to Susan. She's a wonderful constituent in Vancouver Kingsway and a champion for evidence-based approach to policy. And frankly, I think you were reading my mind, Susan, because when I was preparing my notes and as I decided, you know, we could all talk for hours and hours about this subject. I decided to take the framework of reviewing what the facts are and what the evidence is, because this is not an issue of public policy argument where, you know, one subjective view is as valid as the other. For some reason, when it comes to addiction and substance use, we are not following what the evidence and the experts tell us. And the thing to remember is that I think there's a remarkable consensus in this country. I mean, if you talk to medical professionals and addictions experts, people with lived experience, people who work in treatment centers, even people like the Canadian chiefs of police have come to the conclusion that we need to decriminalize. I mean, there's probably some differences in how we get there, but even they have come there, and that's not because they want to or because that's part of their way of looking at the world. It's because they deal day in and day out with the criminal system, and they know that it doesn't work. So based on the evidence, it doesn't work. So how do we ensure that those voices are there? You know, it's I think that it's going to happen organically. I think when this bill, hopefully it'll pass second reading, and that's the next big thing, is that we've had a debate in the House. There's going to be a vote, and this is a very big vote, and we want to get the Liberals in particular to vote for this, to send it to committee, so that's when we can invite the full range of stakeholders and make sure their voices are heard, so that we can build the record of evidence to you know, to go back to third reading. But that doesn't happen unless we get the vote passed. So please, you know, press your MPs and write letters to Mr. Trudeau and everybody else, urging them to vote in favor of this, at least to get it to second committee where we can hear that evidence. And I'm confident that once people do hear the evidence, it's overwhelming.
Thank you, Dawn. You know, here's a question from Mitch T. Have we heard when nasal spray naloxone will be made readily available to all people for free? Right now, it costs $192 and is much easier for younger people to use. I fully support Bill C-216. Maybe Dr. Kendall, can you speak about, just in terms of safer supply and some of the different options that might be available, and as well as harm reduction and the costs related to it? I mean, obviously, you know, our party's been pushing for a national pharmacare plan so that drug costs are covered, right? But maybe you could speak a little bit about that.
Sure. I can speak to it from the BC perspective on the drugs that are available. There's a very wide range of opioids. from morphine, slow-release morphine, hydromorphone, dilaudid, stimulants like cocaine and methamphetamine, benzodiazepines, etc., including, and actually when we look at the opioids, it even includes fentanyl patches and fentanyl powder. Much of that is supplied through the pharmacare drug program. But some of the drugs initially, anyway, were actually funded by Health Canada. And that's where the budgets have come from the relatively small programs that are available. One drug that is missing is diacetylmorphine, which is also known as heroin, which seems to have an awful lot of stigma and aura attached to it. It seems to be the third rail in provincial politics. The reason why I raise this is that many thousands of people in BC seek to go on opioid-assisted therapy to get off illicit opioids, which is basically currently methadone or buprenorphine. Most of them, sadly, have failed on this treatment as it's currently offered in British Columbia. So there's a very high dropout, a high failure rate. In Europe, people who fail on methadone, and these are people who want to get into treatment, stabilize their lives, are offered diacetylmorphine as a follow-up drug, a second-line treatment. About 150 people in the entirety of North America are able to get that, and they're all in British Columbia. So we could at one stroke, I think, and the federal government has given diacetylmorphine a drug identification number. So it could be prescribed, it could be on the national formulary, and people who are currently being failed by methadone could access this. It has been reviewed by the Cochrane Collaborative. BC did the only random controlled trials on this. It's been favorably reviewed by the Cochrane Collaborative, which is seen as the gold standard. It's actually been reviewed by CADIF, the Canadian Association for Drugs and Technology in Health. So this would be one gap that could be filled. Nasal naloxone is another one that's on the list. And if we could develop a low-cost version of it, which would be possible, I think we could add to that. That wouldn't be the question of the safer supply. That's for dealing with the unsafe supply. But currently, BC and Ontario and a few other jurisdictions are working on the prescribed basis. We need to move to a public health model because physicians are actually, frankly, quite reluctant to be gatekeepers to this program. So the longer range strategy needs to develop options for a non-prescribed base, but regulated, safely regulated supply, safely accessible.
Fabulous. If the speakers are okay, can we go till 6:20? That's another 10 minutes. That's excellent. Great. One thing someone just asked about the vote. So just in terms of procedure, we had first hour of debate a couple of weeks ago in the House of Commons. The second hour of debate will be mid to late May, and a vote will take place within a few days after that. So that's how quick this is coming. So it's time to write your MP. If you're wondering how can you get involved, Mom Stop the Harm, Leslie McBain and her organizers have a petition to write your MP, ask them to support the bill, but also call their office and ask for a meeting with them to get them on board and talk about why it's important. Writing a letter to your local editor in your newspaper, making sure that you're talking about it on social media and helping educate people about why this is important. Also, there's you can ask your local government to get on board. Just in my riding alone, Cumberland, Courtney, Comox Valley Regional District, Qualicum Beach, all unanimously just endorsed letters to write to the minister asking the government of Canada to support this bill. So applying pressure, we've only got 2 months. That's the downside of a bill in early order, but the upside is that we can't wait. People are dying now. 20 people are going to die today in Canada, and we can't wait. The sense of urgency is so real. So we need your help and, working with your local stakeholders. So those are just some of the things you can do. Obviously, I've got a YouTube channel. You can see what I'm saying in the House of Commons, and Dawn and Lisa Marie and our team, and just making sure that, you're sharing and promoting the message that you're hearing. And if there's feedback you want to give us, please write us. let us know if there's things that we missed or that we're not talking enough about. We want to work with you, and we rely on you as people that have been, touched or by this terrible crisis or a health emergency. I don't want to call it a crisis. It's a health emergency. The federal government needs to declare it what it is. So I'll just try to go back to more questions. There's so many, and it's getting really hard to try to figure out which one to go on. But they're in the chat. There's areas where you can look at where you can write to your MP and find the bill. And I think that I am going to maybe I'll open it up to the panel, because there's also seeing the chat. Does anyone want to answer any of the questions they're seeing in the chat, or just comment? Just put your hand up and we'll unmute you. Okay, Leslie McBain wants to say a few words from Stop the Harm. We can unmute Leslie.
Mr. Chair.
Yes.
Can I have to send my regrets. I have to go and cook a supper for some guests who have been waiting. So please excuse me and my regrets. But
sure, no problem. We're wrapping up pretty quickly here, Dr. Kendall. We've got about 7 minutes to go, and we really can't thank you enough for being here. We really appreciate it, and thank you for all your work and your advocacy. And we're going to continue to rely on your expert advice as we walk through this and as we move forward to tackle this epidemic. Yeah, and just one thing, just before Leslie jumps in here, I do want to say there was a comment about different provinces, and that's what we're hearing. I just had a presentation from Health Canada around their response to the toxic drug supply crisis, and there's patchwork, as we know, right across the country, within provinces even. Some really good pilots that are working, models that are working, but there's some provinces, as we know, that aren't determined to take this crisis on, some more than others, and that's why we desperately need federal leadership on this issue. We absolutely have to. We need to come together and have a strategy, and that's what this strategy will do, is take that federal leadership so that people that aren't getting the support that they need and action that they need, that the federal government has that role, that overarching role when it comes to the universal healthcare system that we have. And so I just again wanted to highlight that. That's one of the main reasons as well why we need federal leadership on this. And that we know the federal government's been a huge barrier for some of the provinces that have been asking for exemptions like British Columbia around decriminalization. It's been, since last May, I believe, since Vancouver asked for their exemption. Here we are, where it's almost a year and the government of Canada hasn't responded to it. So just in closing, I'll Leslie, I think you wanted to say a few words. Is that correct? And if we can just unmute Leslie, that would be great. And then I think we're going to wrap things up because I see people are getting on with their plans for the evening. Oh, Leslie is not unmuted.
You should be able to unmute
Okay.
Okay, thank you.
Yeah.
I just want to say to some of the, I was trying to watch the chat as well, and I see a lot of folks who have questions about how this would roll out and fears about how it would roll out. And I just want to say that when we have 20 people dying a day who are our loved ones, and we are looking at reasons not to do it, we should take a chance. We've never been in this position before. This is new. It's like, it's a new day in this epidemic of death from toxic drugs and also overdoses. So being courageous and trying new things. The government, the federal government, there's a I won't get into it, but exemption 56.1, sub 56.1, that says if the minister, the health minister, decides that it's in the public interest to exempt certain drugs and promote certain ways, then they can do it. And I don't understand why the federal minister of health and the prime minister cannot see their way to using this as a way in. I know it's stigma and I know it's about political will and so on, but I just want to say it's not impossible. We have to take some chances in rolling out these different ways to protect people.
Yeah, that's fantastic. I really appreciate that, Leslie, because, you know, we saw in COVID, we took chances, we moved rapidly and we responded. And, you know, it shows what we can do in a health emergency when we take it on like that. Lisa Marie, you saw a question in the chat that you wanted to respond to.
Am I
You could
unmuted?
yeah, you are.
Thank-
Yeah.
Thank you, Gord. And I just wanted to acknowledge, it's gone now on my screen, but I noticed that somebody was showing, it looks like a picture of a loved one that's been lost in this health emergency. And I just wanted to acknowledge and thank them for sharing that picture with us today. And I'm sorry for your loss. Yeah. I wanted to speak to the question in there around how could this bill help with jobs? And my mind was going in many different areas around that. I think it is an interesting question, because I think if we look at the economic impacts of us not addressing this health emergency, it's very much costing us a lot of money. If we just want to look at the economic side, I mean, the lives lost in itself are argument in itself. But if we want to look at the economic side, it is huge. And I wanted to point out also the criminalization of this health emergency is not saving us any money. It's it's actually creating more costs by criminalizing substance use. And absolutely, if we took an approach that was compassionate and health-based, one that took care of, if we get in the business of taking care of one another, we're going to see jobs created. We're going to see jobs that not only provide immediate supports, but are investments into one another and into our communities and into our health and wellness. And so I'm sure that question is probably posted in order for us to address that. And so I just appreciate that, because that is something when I'm knocking on doors in my community, this is a question that comes up. People want to understand, how this works and how this bill would help our community as a whole, along with the individuals whose lives are being lost or being impacted by this. So just wanted to address that. Thanks, Gord, for allowing me the chance to speak to it.
Really appreciate it. So in closing, because there's so many things we could talk about, Lisa Marie, thank you. You opened up a whole conversation there. I think Gabor Mate said it. It's been a war. Our policies have been not a war on drugs, it's been a war on drug users. And we need to end the war on drug users. This bill has, the potential to do that. The Prime Minister keeps saying it's a health issue. Even the Conservatives say it's a health issue. But right now, it's a criminal issue in this country. So the stigma starts with the Prime Minister. He relied on experts through COVID-19 to give him expert advice and direction. And, he needs to do the same thing here. He has an expert task force that he subscribed to and said would give him guidance, but he's not listening to them. So we need to ask him to do the right thing and to follow through with that. I know that people are writing in the chat, so we're going to keep that. There's an email that's going to be dropped in there to write to the NDP, and so that we can have your comments, and we really, really appreciate them. This isn't the end of the conversation from us here. This is the first forum. We're going to have another forum next month. We're not going to stop. We're going to need your help. Bills like this do not pass without a movement happening in this country. And it's going to take you. It's going to take you writing letters, like I said, to the editor, talking to your neighbors, explaining why we need to take evidence-based decision making and listen to experts and a compassionate approach when it comes to this issue and the toxic drug supply crisis and the magnitude of it. I know MP Julian, our House leader, is also on here. I want to thank Peter for joining. And I want to thank Peter for more than just joining. It is our party. It is a priority within our party. And as you know, there's many, many issues in the world happening right now that need to be talked about in the House of Commons. But it takes our House leader and it takes our leader to ensure that I'm getting the floor, Lisa Marie and Dawn, on this issue and ensuring we get a chance to make sure this is front and center of this government. They're making sure that's happening. So I want to thank them, for making sure that we have this platform to be able to deliver this really critical message and this opportunity. I want to thank all of you for taking time. Clearly, the next time we do a forum, it's going to have to be longer. We're learning that because this is such a critical issue. And, you know, most everyone stayed on right to the end and I know why, sadly. That we have in common. So thank you. And stay in touch.
Thanks, Gord.